Hi, everybody.
Hey.
Hey. Hey,
Hi,
everybody.
hey. How's it going?
So we tried to go live with you guys on Wednesday. Did not work out to our benefit. You know, something, though, that came out of trying was you actually trying to say my, hey, everybody.
Oh, yes.
His voice actually does go up that high.
We're not going to do that right
What
now.
do I normally say?
Hey, everybody.
Hey, everybody. So we're so glad to come with you. I know on Wednesday we were supposed to have this go live about talking about backs and just back pains and different ailments and so forth.
And you tried to trick me.
And I totally tried to trick you. I had it all planned out, even on how I was going to start off with back pain and then, you know,
Wow, ease into it.
Ease into, well, how's that thing over there going to help with back pain?
Mm-hmm. And that over there, that's the sauna.
He's sitting next to the machine.
The machine.
The machine. We need a name for the machine. You guys can give us little.
That's a hypothermic ozone chamber.
I want a name though, like Mina. My alter ego, Mina. So anytime you guys call and the front desk person does something wrong, it's Mina. It's
Mm-hmm.
always Mina.
Yeah.
You always have to talk to Mina for anything that goes wrong in the office. So we need to,
maybe we need to resolve the problem.
Well, we'll talk to Mina about that
Okay,
later.
we'll have to discuss that.
So this is the reason we're coming to you guys live today is obviously Facebook was down on Wednesday. We all survived it, but
it was tough.
We managed to get through it. So I did have to tell him that I, of course, was trying to trick him because yesterday the big surprise came.
Mm-hmm.
We got the machine.
Yes.
Which is what?
It is a hypothermic ozone chamber with oxygen distribution.
This is why it needs a name. So, what does it do?
So it's like kind of looks like an egg. You've seen pictures on it. If you just scroll down on the page, you can see it. So you're sitting in an egg, and basically it's a steam sauna. So you have all the benefits of a sauna, and we can discuss that. And then you also have ozone that's pumped into the chamber itself. So you have the benefit of ozone therapy, and then you have the option of wearing a mask, of an oxygen mask, and we have oxygen directly being inhaled, and it super oxygenates the body. And in an oxygen-rich environment, it's very difficult for bad things to live.
Okay. And so I think one of the coolest things about this machine is that it does, I mean, you said a couple things here. So one, you sit in it. Mm-hmm. I personally don't even like elevators because I don't like to feel claustrophobic.
Yeah.
And the cool thing about this is there is room while you're sitting in it.
Oh, there's a lot of room, yeah.
And your head's out.
Mm-hmm. Your head is out. So you don't have to like get exposure to all the heat and the steam. Sometimes a big thing with saunas, especially steam saunas, you're breathing in that hot air, and that's some of the most intolerable stuff. So with this, your head's out, and you can breathe the air or oxygen, depending on what you need and what the doctor's gonna kind of prescribe for you.
So that's the other thing. So I know you guys always personalize everything to an individual's needs.
Yes.
And the machine does a few things, not just one thing for everybody.
Mm-hmm. Correct.
And so will you be testing people to figure out, or most of the people, you're gonna know them?
Yeah, you can't really test, but we'll know just from their clinical history what the best route would be and how to start. So sometimes, depending on how toxic the body is, because the ozone is going to really assist in detoxification, you may just want to do the sauna first. And the temperature, we can vary the temperature and it regulates itself. So you'd start at a lower temperature and then gradiently increase that. And then over time you can be warmer and warmer and warmer. But yeah, it's just kind of depends on what you're going to need. And we have a good idea of most patients' clinical history here. So yeah.
Okay, so tell us the different things. Like you have told us a little bit. Mm-hmm. So if I want to go, am I going to be hot?
Yeah, it's warm. I mean, it's a sauna, and it's nice because it's a moist heat. It's Jamie's least favorite word, but I use it. So it's a moisty. It's better than a dry, like an infrared sauna. Infrared saunas, sometimes people with problems with their like mucous membranes are called, like if they have dry skin, sometimes it dries you out even more, even though you sweat. So this is nice because it really helps the skin and it detoxifies the body. So the skin's considered like the third kidney. Like 30% of detoxification can happen through your skin in your body. And the more you can just kind of eliminate toxins through the body, the better. And then, also you have decreased muscle and joint pain with the heat. You increase your immune system, like white blood cell production in this. So there are a lot of benefits on sauna therapy in general. It's highly detoxifying, so it really helps to flush out the garbage. And the more your cells are kind of floating around in toxins, the less nutrients can get into them. So you want to flush it out to allow good nutrients to enter into different areas of the body.
So I know, I mean, I popped in yesterday. I know you guys probably saw a picture of me looking like I was putting the machine together.
And it's a trick.
It was totally a trick because if any of you guys know either one of us, I am definitely not the technical person. Thankfully he is, but he didn't want to get in the picture yesterday, so I took credit for all of it. But my kids were in here even, and it was so funny because they were like asking, different questions about the machine.
Yeah.
And, we left here and I was like, yeah, so, I mean, we rebuild our cells are constantly rebuilding themselves.
Always, yeah. And to be able to do that, you have to get the garbage out so that nutrients can surround your tissues. So detoxification is a huge deal, especially in the environments that we live in today. I mean, even sitting in an office, we're exposed to a ton of things. So yeah, it's really important to do.
And then the ozone, if somebody did the ozone.
So ozone right now, we're only offering it through the ozone chamber. And whenever you open up your pores because of the heat and the moisture in there, and the ozone can actually go in and penetrate the body. And ozone is an activated form of oxygen. And it really cleans things up. It kills a lot of things that shouldn't be there. And it actually is an immune system modulator, which means that if your immune system is really like hyperactive, like you have an autoimmune type thing, or if it's really underactive, like you're immunosuppressed, like the elderly sometimes are, or you have someone that just can't fight off infection, they're always sick, it elevates the body's immune system capacity. So it stabilizes everything. There are a lot of other benefits. It increases the red blood cells' ability to carry oxygen. So the more we can oxygenate our cells, the more they're able to produce energy and live the way they're meant to live.
So you and Dr. Sarah tested this out yesterday.
Yeah.
I have not tested this out yet. So how did you feel afterwards?
So afterwards, just because of the heat, you have to kind of get used to it. It's like being in the sauna. You get up. Dr. Sarah said her skin was a little tingly afterwards. Mine wasn't. And you just kind of reset, and like a minute after, you feel like really good. You feel like clean, but you just worked out. The same type of feeling. And then we went home later, and you can kind of smell the ozone. It's like a clean smell. It's nothing crazy. We went home, and it was like it was kind of like you worked out again. I climbed my stairs, and my legs were they felt like worn out. And the reason for that is because I just detoxified. I loaded a bunch of toxins out of my body, and the body's just working on processing that all the toxins. I'm sure my body was killing things off too, because you're increasing the white blood cells. So different feeling. I slept really well last night, and actually didn't want to wake up this morning, which isn't normal. So my body was, I went into a very deep sleep, which is healing. And that's all I could tell you right now. But other people are going to have different experiences. Just depends on what's going on.
And so is there anybody, do you think, and I mean, I've only been reading about this for a week now, right? Do you feel that there's anybody who could not need this?
I think it would benefit everyone.
That's what I keep coming up with too.
Yeah, there are really no contraindications. So like reasons for you not to be able to do this, except if you have, really you have high intolerance to heat, and again, we can regulate that. And if you're ever uncomfortable, you can always get out of it at any time. It's not like you're locked in or anything like that. So, I mean, it's safe. It's a comfortable environment. The benefits are great. And then you have oxygen too that we also can use with that. So while you're in the sauna, a third thing is we have a mask, an oxygen mask that you could wear. You're breathing in the oxygen. So in the sauna, you're increasing your capillaries, your little blood vessels are opening up, and your heart rate increases just slightly. It's just like exercising just because of heat. It's a natural body response. And you're flooding the body with oxygen. So you're getting oxygen into areas that aren't normally getting as much oxygen as they should. So whenever tissues are damaged or not working right, inflammation is there. And the more inflamed, the tighter the capillaries are squeezed, and the blood can't get to these areas. So we're using the heat, we're increasing the carrying capacity of the red blood cells to carry the oxygen, and we're flooding the body with oxygen at the same time. So we're super oxygenating and giving all the cells what they need to work right. And a lot of this, like if you do some research, you can see something called EWOT. It's EWOT. It's exercise with oxygen therapy. And you actually, in a sauna, you don't need to do the exercise portion because you have that. It's like you're exercising already. Your heart rate's up a little bit. Your capillaries are expanded. So the same processes are happening in the system. You just get to relax in the sauna instead, which is kind of nice.
Okay, so I love that there's so many different options.
There's more too.
There's more?
Yeah.
Okay.
Do we want to talk about it now or not?
Yeah, let's talk about it.
So we also have ozone that's kind of bubbled up through oil, and it can't really use probably going to use avocado oil, and you can't use essential oils for that because they can be volatile, so they can catch on fire. So we want to use probably avocado oil, and we'll do some videos on this. But you bubble the ozone through the oil, and then you breathe it in. You have what's called a cannula. It's like what
the little nose things.
Yeah, the little nose things.
Mm-hmm.
And you sit there and you breathe it in for about 15 to 20 minutes. And with that, you're not actually breathing in ozone. You're breathing in what are called terpenoids. And for those, what they do is they also help to assist your body in killing things off, and they deflame the system. So people with like chronic respiratory conditions, like chronic sinus infections, lung infections, just inflammation of the sinuses and lungs, it helps to deflame and bring that stuff, kind of help your body clear it out a little bit better. We're doing something else too.
Sauna, ozone.
Yes.
The cannula.
Oh, we have ozone cupping too. So we have a little cup, and you can put it on skin. So it's good for different skin conditions like eczema or infections. We don't fight or kill infections here. It's just something that can be utilized for that. But we put it on the skin, and it actually assists the body in healing and cleaning some stuff up there as well. And we're going to do another therapy, thinking of it, but we won't discuss it right now because that may be coming in the future with ozone.
Another surprise.
Possibly.
I love surprises. I absolutely love
we'll keep
surprises.
You waiting. Something to look forward to, I guess.
I love it. Okay, so, the two biggest questions are going to be...
I know one you're going to ask, and I don't have my list.
You better... Where's the list? I was actually looking down to try to find
it. Whose
room is the listed?
I'll grab it real fast. So,
awesome. Yeah, leave me on a go live hanging. I'm going to tell them all kinds of stuff goes on. Not really. There's really nothing that goes on here, but I got it. Oh, that was quick. Great. You were afraid of what I'd come up with on my own, having to talk and to go live.
I had to get back fast. All
right. So 2 questions.
Mm-hmm.
One is, how soon are we scheduling?
So we're probably going to schedule a couple next week, but these are going to be reserved for people who are we've been working with these patients for a long time and are in dire need for it. So they have the first slot. There are long-term patients that really, really, really need this for specific reasons. And then it's going to give us an idea to see how much time it takes and allow us to be able to be on schedule like we always like to be here, so that whenever we start scheduling everyone the following week, you don't have a long wait period, and we have everything running and flowing efficiently for you. So yes, next week a little bit, the week after definitely, and then continuing on from there.
And so one of the reasons you're saying how long things are going to take is because what do you wear in this?
So you don't wear anything.
Your birthday suit.
Yes, you wear
your birthday suit.
It's because ozone will discolor your clothing, and it messes with the fabrics a little bit. So yeah, you're actually in the sauna, and you have a towel down, and then one that's kind of around your neck here just to keep the ozone in and the steam in. It's pretty comfortable, but yeah, you'd have to bring your own towels for this as well.
And you would need 2 towels, you're saying, the one for on top and then one to sit on.
2 is usually enough. Sometimes people like 3 just because the one around their neck gets a little wet, but typically that's all you need.
Okay.
But yeah.
And then here it is. The second question is,
yes,
how affordable is this going to be?
We're making it extremely affordable. So I have my prices here, and this may change. So this is what it is right now, okay?
Oh, but wait, there's more.
What's that?
I mean, seriously, nobody has this anywhere.
Yeah, they're tough to find, especially the quality of this.
I was so excited. This is one of the things I was most excited about because it's not, most people, I couldn't find it anywhere locally.
Yeah.
I mean, you really had to travel a long ways to get this.
True.
And then the prices to go there, I couldn't afford to go and do it.
Yeah.
And so I'm pumping you up on this one because it really is awesome compared to what other places, far distances,
yes,
would be. So
it is. It's a good price.
I won't interrupt you this time.
Okay. So we have it set up differently. So we're gonna have for a week, we're gonna do, it's not the first week, it's the second week. We're gonna do 40% off of these for just as a promo, okay? So the regular price for ozone, oxygen, and steam sauna is $90. For patients, now patients get a 25% discount always, okay? So patients, that'd be $67.50. For the promo, it's $54. The ozone and steam sauna, so that's without the oxygen, is $75 regular price. Patients get 25% off of that, so it's $56.25, and then the promo is $45. The oxygen and steam, it's going to be the same prices, so $75, $56.25 for the patients, and then $45. The steam sauna alone is $35, and typically these are like 15 to 20-minute sessions. For patients, it's $26.75. And for the promo, it's only $21. And then the ozone cannula. So that's whenever we're bubbling the ozone through the oil, and then you're wearing the cannula here. It's about 15 minutes, and that is $65. Patients would pay $48.75, and the promo is $39. And then the cupping for the skin and specific targeted areas, it's about 10 minutes, and it's $40. And for patients, it's $30, and the promo is $24.
I love it. It's amazing, right? So I'm super excited to try it. I can't wait. I totally forgot my towels today, but I couldn't.
I'm going in.
You're going in again?
Yeah. Dr. Sarah and I are both going to do it after we treat you guys today.
I love it.
Yep.
Okay, so if you guys aren't yet a patient, then you guys can always give us a call at 724-205-6260. I'll be the one answering the phone. We can get you started on becoming a patient if this is something that you're interested in, not only just for the machine, but for the expertise of these two. It's Dr. Colin Kinsales and Dr. Sarah Vivona. And we always save our videos on here because our time to do these isn't always the most convenient time for you guys. So you're always more than welcome to look at the reruns and check out our website. It's www.ihwcenter.com. And then we also have all of our videos uploaded, well, most of them anyway, on our YouTube channel, which is just Integrative Health and Wellness.
Yep.
So, yeah, just give us a call if you guys need anything. And you guys are so good about giving out information.
Mhm.
So I know like this is just kind of a little bit about what's to come, because I know we'll get a little more in depth with the machine the more time goes on. So anyway, I don't want to tell you guys to call if you have any questions, because I, at this point, know everything you do right now.
All right.
So have a great weekend. Bye, guys.
See ya.
Hi. Bye. See ya.
It's
Hey.
we can't get off of it.
We're stuck on a go.
Uh-oh. We are
We're
stuck on
stuck on a go line.